Morning. So, today is the day of surgery. Finally, we are doing this Latissimus Dorsi flap surgery. Um, Today is the 9th of July. I had the failed surgery, the removal of the breast implant that was done back in towards the end of February. So it's been a couple of months. Um, I want to say by around May, I started feeling good again. So, that's the only thing. It's like, oh, I can move and I can lift my arm and I can do all of that other stuff without there being this, pain from having been cut open from surgery or everything like that. And now it's like, all right, there's going to be pain again. And this time they are cutting open your back. So it's going to be like double pain. Moving on my right side is going to be near impossible. So I've taken off of everything for a month. And I'm hoping that I need to be back ready to work because I am scheduled on a wedding a month from now. So I need to be 100%, at least not even 100%, 65% in a month. I need to at least be able to lift a makeup brush and scribble. So, yeah. But, that's it. I can't eat right now. So that's why I'm not getting out of bed because it's not like I can get up and grab something to eat or drink, It's the whole no meals after midnight. And the last thing I ate or drank was around 10 o'clock last night. And surgery, excuse me. Surgery is not until 3:30 today. I have to be there at 1:30. It's not until 3:30, and that's if it starts on time. I don't know how long I'm going to be in the hospital, so we shall see. I've heard conflicting reports. I've heard anything from 1 to 2 days till 3 to 4 days. So I'm not looking forward to that because when you're in the hospital, they just always find reasons to stick you with needles, especially that one where they're like, oh, because you're not moving, we don't want your blood to clot. It's a shot. So that means they have to stab you with the needle. Yeah. And the only place they can stab you with this needle is either in your arm or in your stomach or in your butt. So the last time I was in the hospital, I went with them giving me the needle in my stomach. Hated it. But yeah. So I feel good in a little bit. I'm not going to feel good anymore. So woe is to that. But I keep yawning. I'll see you guys on the flip side. Okay, so I'm just coming from my plastic surgeon's office and he marked all over my body. So I'm on my way to the hospital. Literally, his office is down the street from the hospital. So the hospital, once I pass this light, I just turn right in there and boom, I'm at the hospital. Why am I driving myself? Because people run on CP time. So I have to drive myself there and I'm meeting, because I had to do his appointment first. And my family wasn't going to make it in time to take me to the appointment and then take me to the hospital. So I just told them to meet me at the hospital. So they should already be at the hospital. And yeah, one of them will just drive my car back home. So yeah. Whew. Play that song again. Baby was dancing. Go ahead, baby. She liked that song. Because she liked ratchet music. What? Yeah, baby. Who's that? No. No, don't touch that. Okay, so let's put that back. We've had surgery. Piece of cake, piece of pie. Doctor said there was a lot of scar tissue, so he wasn't able to put the implant in. So there's going to be another surgery where he might have to do another tissue expander, or he might have to do the implant. So we don't know just yet. I have to be on oxygen because he said oxygen helps with the healing process. So that's why this thing is shoved up my nose right now. I feel great, but I am on a nerve block. And they said when the nerve block wears off, that I'll be in excruciating pain. So they started me on the Percocet because they don't know when the nerve block will wear off. I have my nurse here with me. She's over there asleep. My favorite nurse. And she's over there. That's my little Zia Sweet Pia Mama Mia. My bucket here because I'm nauseous. I'm always nauseous after I throw up after anesthesia, and I don't know, she's watching TV. So but that's all right now. Again, feel great. I have a drain somewhere, like I don't know if you can see this red one. The blood is draining. I was bleeding like over everything, so they had to change my dressings quite a few times because I was just bloody. They had to change the sheets and everything. It was just bleeding profusely. And my drain is filling up rather quickly. It's like every half hour they have to empty it. So I'm not looking forward for this nerve block to wear off. But yeah, that's it. They have this awesome television here. It's a computer. Every time a nurse walks in, because the nurses have to wear this, I don't know, electronic thing around their neck, and then every time they walk in, the TV says who's coming in, like, oh, nurse so-and-so is in your room. It also tells you what time you had your last medication and what time they're going to give it to you again. It says your doctor. It's off right now because there's a moon on it, so I guess people are sleeping. But it's so cool. I didn't know they had that type of technology. But I'll talk to you guys tomorrow. I'll see how I feel tomorrow. Bye. Okay, so today is day 2 post-surgery. Surgery was on Monday. Today is Wednesday, and I'm still in the hospital. And I'm noticing that I'm getting a bit of an attitude. I think, like yesterday, I was able to deal with somebody coming in the room like every hour, bothering me. And now, I just think the lack of sleep is catching up with me. So now every time they come in here, I'm just annoyed. Like, Just leave me alone. Let me get some sleep. I've been getting up myself. I walked around last night, and I've also been getting up myself to go to the bathroom because someone turned my IV up real high, so I have to go to the bathroom like every 2 hours. So the next person that comes in this room, they're gonna get told, like, I can drink fluids. You guys can turn this saline down. So that was just someone knocking on the door again. But that was dietary issues. Bringing me my breakfast. Um, what was I saying? Yesterday was a bad day, which is why I just did not record yesterday. Was trying to get the pain was under control. Like, I'm in more pain today. It's just what was running rampant yesterday was my nausea. So I just kept throwing everything up. And then finally, they gave me Finnegan. I think it's the name of it, which I was hesitant to take it because I think that was prescribed to me when I was going through chemotherapy. And there was something about it that I did not like. And I remembered what that was after taking it yesterday. It was the fact that it puts you to sleep. You cannot function when you're on that. You are like completely drugged. So that was hard because I was waking up. My IV flow was up and I was waking up needing to use the bathroom. It was terrible. Um, so yeah, last night around 9, I finally got up and started walking around. Uh, what else do I have to say? Today, hopefully, I can be released. Here's to hoping. What do you call it? Whatever, assistant doctor, not my main doctor, she's the assistant to him, came in and said she needed to order blood work. So hopefully they can get that done. And hopefully I can get out of here today because I don't want to be here. I was finally able to get up and brush my teeth, and I washed my face with those towelettes that I brought. So we'll see how today goes. I think I said everything. If I talked about the bleeding, yesterday I was bleeding a lot. They had to change the bandages a lot. So if that was discussed, the bleeding is under control now. Oh, the doctor yesterday said that there was a blood clot in my chest area up here. So he said he's going to watch that to see if it goes down. If it doesn't go down, then he's going to have to take it out himself. I don't know what that means. Like, how would you go about taking it out? And then I'm on the oxygen. I believe I've said this before because he said it helps with wound healing and oxygenating the blood and all of this stuff. So everyone keeps asking if I'm on oxygen at home. I'm like, no, he keeps putting me on this. So that's what the oxygen is for. But that's all. I'm going to get into this food because I'm hungry. Since yesterday, everything I ate, I threw back up. I am going to try to eat these pancakes and eggs and whatnot. All right, guys. Bye.